gotta do something.
Hey y'all, welcome back to my channel. It's your girl Ty. So I just want to come and quickly talk about this topic that's been kind of bothering me because I follow a lot of nursing pages and vlogs or whatever you want to call it on social media, and it just really irritates me when I see comments that some nurses make regarding CNAs. It's like it's a lack of appreciation, a lack of respect for the role of the CNA. CNAs are very vital to the healthcare team, and without CNAs, many nurses would not be able to do their jobs effectively because everything that is in the scope of practice of a CNA is within the scope of practice of a nurse. Now, I am a CNA and I am a nursing student, and everything that I learned as a CNA is a part of my fundamentals of nursing. So some nurses think that they are above bedside care, bedside mannerism, doing basic tasks, but we're all there to care for the client overall. Now, are there some good CNAs and some bad CNAs? Yes. Are there some good nurses and some bad nurses? Yes. So that does not mean that you should not harbor negative or biased views towards CNAs because you've had a bad experience or you've worked in a facility where you feel that CNAs aren't doing their job, because just like with any profession, you're going to have good and bad employees, but that doesn't take away from the people that really do well at their job. Now, I've been a CNA for many years. I've seen comments on the internet like, okay, well, all CNAs do are they wipe butt and they do vital signs and it's not that hard and that's it. No, baby, that's not all CNAs do. CNAs are probably one of the first people that are in the room with the client, your client. CNAs also have other tasks depending on what facility they work in. For example, I work in a hospital, so I'm not just a CNA that wipes butt. I do vital signs, EKGs, finger sticks, bladder scans, tracheal suctioning, trach care, Foley catheter insertion and removal, IV insertion and removal, tube feedings. So it just depends on where that CNA works. We're not just butt wipers. No. Secondly, CNAs, as some people like to say, some nurses like to say, my CNAs, your CNAs are human beings. And many of them may have other professions or other goals outside of being a nursing assistant. Just because someone is a CNA doesn't mean that they're uneducated, because I've worked with CNAs that have bachelor's degrees. I'm a CNA, I have an associate's degree. It doesn't mean that a CNA has that they don't have any type of education. You don't know people. We're all humans, we're all adults, and we all deserve respect. Now, I've worked with some really great nurses, and I've had a great rapport with those nurses. But, I do my job, and I respect other people, and they respect me. Now, are you going to come across some rude, nasty nurses that have a superiority complex? Yes. That's going to happen at any level of nursing. You're going to have LPNs that are feeling like they're better than the CNA, RNs that feel like they're better than the LPN, and BSNs that feel like they're better than everyone. So, yes, there's a hierarchy of, I don't want to call it narcissism, but it is in nursing. Now, are CNAs all innocent? No, because I've worked with some downright rude, excuse my lingo, ratchet CNAs that just don't give a F, will tell the nurse where to stick it and what they're not going to do. They will hide out. Yes, those CNAs deserve to be called out. Because we're all there to do a job. We're all there to care for the clients. And if you're not doing what you're supposed to be doing, then you don't need to be there. Also, as the nurse, it's your responsibility to report any of those things to the manager or whomever the superior person is that you would go to, and possibly have them removed from that position because they don't need to be there. But one thing I will not do is work in a hostile work environment. And me being a CNA now, when I do finish nursing school, I'll know how to interact with, CNAs and, just have a sense of understanding, because you can really tell the nurses that started off as nursing assistants. Some nurses don't want to get their hands dirty. They will not help you with anything related to like changing a patient. It's just ridiculous. So yes, don't tell me that just because you're a nurse and okay, I'm a nurse, I have to do, because being a nursing student, I know kind of what's on the other side of being a CNA. Yes, nurses have a lot of medications to give. They have a lot of charting to do. They may have doctor's orders to implement, things like that. But, being a nurse is also about those foundations and fundamentals. You're not going to risk your patient's skin integrity or risk them falling trying to get to the bedside commode because the CNA is unavailable and you feel like that's not your job, when in reality that is in your scope of practice. Yes, as a nurse, you will possibly have to toilet a person. You may toilet, you may have to give a bath. And so many CNAs are leaving the healthcare field because they're undervalued, underappreciated, and underrepresented. And, why stay at this job and I'm making pennies, $15 an hour, when I can go to McDonald's or I can go to Aldi's and I don't have to take verbal, mental, physical abuse from people who feel like they're superior or they don't have to assist me. Yeah. And then there's like, at some point, it doesn't matter how professional you are, you're just going to deal with some catty individuals. I've had nurses that will go in their little report room and they'll close the door and they'll all, talk about the CNAs or the techs, which ones they like, which ones they don't. And it's just like, is this high school? Are we in high school? Yeah. Grow up. No one wants to work in a hostile work environment. And those are the kinds of jobs I will leave. Like, nursing is a revolving door. If I feel like I'm being mistreated, or if I don't feel like, I'm working in a safe environment, I will resign. I will turn my badge in. And I have not had a problem getting another nursing assistant job. So, as a CNA, tech, whatever position you're in, know your value. Even as a nurse, know your value. Know that, you don't have to, if you go and report these things to your manager and you feel like, nothing has been resolved, then leave. You don't have to take that abuse. And a lot of people aren't taking that abuse anymore. People are leaving the field. They're fleeing. And then let's talk about the unspoken thing. Depending on where you work, a lot of CNAs are African American. And that's just from what I've seen. I'm not saying there aren't any Caucasian, nursing assistants, because there are many. But I've seen, like, predominantly in my area, the CNAs are African American, and many of the nurses are, Caucasian or Asian. And not to say that we don't have African American nurses, but I've worked in hospitals where it's been predominantly white, and there is racism. Point blank period. You could be the nicest, sweetest person and, do your job, and you're still going to have racist people that are just going to dislike you just because of your skin color, which is absolutely horrible and absolutely sad and pathetic in 2023. But some people are educated, I guess, book smart, but not morally smart. They're not common sense smart. They just, I don't know. They judge people based on their biased views. They don't get to know you. They don't care to get to know you. They just don't like you just because you're black or you're Asian or whatever. Oh, for all my current nursing students, don't be that nurse. Be better, do better, know better, break the cycle, break the chain, break the nurses eat their young, just be culturally aware. And it's so weird because if you do a hospital orientation, they have all these classes about diversity and cultural sensitivity and, how to work with your team and teamwork. And then it's like, okay, people go through that orientation and they must not pay attention or they must not absorb or they just blatantly don't care. But you be better. You be the change that you want to see in healthcare because people still need nurses. People need nursing assistants. And being an agent, being as though I worked agency a lot, they are losing their techs. They talk about the nursing shortage, but they don't talk about the tech shortage. And now nurses are having to be CNAs too. The nurses are having to be the CNA. So no, nurses, don't just think that, oh, that's the CNA's job. Because no, if that CNA doesn't show up to work, that's your job, sweetie. Yep. That's your patient. That's all I have to say.